سميرة تخاف على أولادها بشكل مفرط، وتنتابها بين الحين والآخر نوبات من الهلع الشديد، ويصل بها الحد لأن تتصل على هاتفهم فيما لو تأخروا 5 دقائق فقط عن موعد وصولهم المعتاد.
أين أنت يا ابني؟ لقد تأخرت 5 دقائق. هل حصل شيء؟ هل أنت متأكد؟ قل لي أرجوك إن كنت بخير أم لا. صدري يؤلمني ونفسي يضيق. لا تذهبي يا ابنتي، لربما يحصل حادث مروري. أرجوك لا تذهبي.
لا تقلقي يا أمي، كل شيء سيكون على ما يرام. باي.
Panic attack can happen to anyone. There is no signs or symptoms that are in advance noticeable. It doesn't have a time or any particular place that it can happen. Attack can come as a surge. It is all of a sudden pain or heartbeat that can cause an attack, so much so that you think you're getting a heart attack or you're going crazy or you're going to die. There are chest pains, you may shiver, you might start fainting, you might start sweating, your hands can get clammy and so on. All these symptoms are actually for panic attacks. If not treated, it can become a panic disorder. Panic disorder is when it becomes repeated and you cannot handle it, and it happens all the time, most of the time during the day.
Now, one thing that can cause or trigger panic attacks and anxiety is your thinking style. It is similar to what we do in problem solving, where we think, but where it becomes excessive and we're thinking constantly and we're chewing things over and we just seem to be thinking over the same thing and not achieving any solutions, where we're repeatedly thinking about the same thing. It becomes a circular thinking pattern. Our thoughts keep returning and it's difficult to get out of this thinking habit, and our brain becomes overworked, causing us to worry and to be more hypervigilant. There are different types of worry. There's worry which is future focused, and it makes us feel that we're not going to be able to cope with what's ahead. It makes us feel very weak. This can lead to severe anxiety, stress and fear. And we're constantly asking ourselves, what if? Or imagining the worst things that could happen. There's also rumination, which is past focused, and where a lot of people who have left their countries and left loved ones behind, are always saying, if only, or if only I had done this, and having lots of regrets. And this can lead to depression, sadness and shame.
Now, to get this treated, you can see a psychologist and organize some therapy. Medication alone is not enough. Medication can rule out symptoms on the spot, but the treatment for the attack is to see a counselor for therapy. There are also services that are in different languages. So Arabic services, for example, can go to STARTS. They have counseling and therapy there. Most of these therapies are free, and so if you get a doctor's referral, you can treat this. Parents, especially for children, have to be very careful that these anxieties and panic orders are treated right at the beginning so that it can get rid of it when they grow up. Also, families need to support one another. If you think somebody in the family has panic attacks often, it's better to see a doctor, get a referral and see a psychologist. I know that panic attacks, when treated earlier, can be cured. So if you have any help, please go and see a psychologist.